Have you ever felt your heart beat too slowly or noticed an irregular rhythm, and wondered if it's something you should worry about? Maybe you've felt lightheaded or dizzy, or just can't catch your breath. It's easy to ignore these signs, especially if they don't happen often. But what if they're trying to tell you something important? Today, we're diving deep into a condition called bradyarrhythmia, a type of heart arrhythmia that could be a sign of an underlying health issue. And by the end of this video, you'll understand what's happening with your heart, what symptoms to look for, and when it's time to talk to a doctor. What is bradyarrhythmia? In simple terms, bradyarrhythmia happens when your heart beats too slowly and irregularly. Normally, your heart beats between 60 and 100 times a minute when you're at rest. But with bradyarrhythmia, your heart rate dips below 60 beats per minute, BPM, and doesn't maintain a steady rhythm. That's where the issue starts. But wait, just because your heart rate is slow doesn't always mean something is wrong. Some people, especially athletes or those in great shape, naturally have a slower heart rate, even dipping below 60 BPM. It's their body's way of saying, I'm fit, and I don't need to work as hard. The trick is knowing when a slow heart rate is normal and when it's a warning sign. Bradyarrhythmia versus bradycardia. What's the difference? You might have heard of bradycardia, which is simply a slow heart rate. Bradyarrhythmia, on the other hand, means your heart isn't just slow, it's also out of rhythm. Think of your heart like a drum. A slower beat isn't always bad, but if the beat starts skipping or stuttering, that's when you should pay attention. While bradycardia can happen when you're sleeping or during moments of rest, bradyarrhythmia usually points to something deeper, like a problem with the heart's electrical system, which controls how and when your heart beats. Symptoms to watch for. Some people with bradyarrhythmia might not feel any different at all. Others could experience fainting or feeling like you might faint, dizziness or lightheadedness, shortness of breath, even during simple activities, fatigue that feels out of proportion with your normal energy levels, chest pain or discomfort, exercise intolerance, meaning you get winded way too quickly. Now, don't panic if you've had one of these symptoms once or twice. It's important to look at the bigger picture. Is this happening often? Is it getting worse? Are the symptoms interrupting your daily life? What causes bradyarrhythmia? So, what triggers this condition? The heart is a complex electrical system, and any disruption in its signals can cause bradyarrhythmia. Some common causes include problems with the sinus node. This is the heart's natural pacemaker. If it isn't working properly, your heart's rhythm may slow down or become erratic. AV block, the electrical signal from the upper chambers of the heart, the atria, to the lower chambers, the ventricles, can get delayed or blocked. This can cause a slow and irregular heartbeat. Being an athlete, yes, being in excellent shape can sometimes lead to a slower heart rate. But it's important to rule out other causes. Certain medications, some drugs, like beta blockers, can slow your heart rate. Always check with your doctor if you suspect your medication might be affecting your heart. Heart disease or recent surgery, damage from a heart attack or surgery can interfere with your heart's electrical system. Infections or high potassium levels, these can disrupt how your heart functions, leading to bradyarrhythmia. And sometimes, doctors simply don't know why it happens. That's called idiopathic bradyarrhythmia. It's rare, but it happens. When should you talk to a doctor? If you've noticed your heart slowing down and you're experiencing symptoms like dizziness, chest pain, or trouble catching your breath, it's time to check in with your doctor. They'll likely run a few tests, such as an ECG, which measures the electrical signals in your heart. If your symptoms come and go, your doctor might send you home with a heart monitor. This could be a Holter monitor, which you wear for a few days, or an event monitor, which keeps track of your heart's rhythm over a few weeks. These devices help detect irregular heart rhythms you might not notice on your own. What are the treatment options? Here's the good news. Not all cases of bradyarrhythmia need treatment. If you don't have symptoms, and your slow heart rate doesn't stem from a serious underlying condition, you might not need any intervention. But if your heart is too slow to keep up with your body's needs, treatment can help. Your doctor might recommend addressing the cause. If an infection or high potassium levels are causing your heart rate to drop, treating the root cause can fix the issue. Medications. In some cases, doctors prescribe drugs to stimulate the heart to beat faster, especially after a heart attack. Pacemakers. When your heart's electrical system is damaged or weakened, an implantable pacemaker can take over, keeping your heart beating regularly. Outlook and long-term health. For many people, bradyarrhythmia can be managed successfully, especially if an underlying condition is treated. If you need a pacemaker, it can significantly improve your quality of life and keep your heart beating at the right pace. But here's something important to remember. Not all arrhythmias are the same. Some types, like those caused by scarring in the heart or certain diseases, can be more serious and may require closer monitoring. One example is sick sinus syndrome, a condition more common in older adults. While the 5-year survival rate for this condition varies between 45% to 70%, the sooner it's diagnosed and treated, the better the chances of managing it well. Wrapping it up. Bradyarrhythmia might sound scary, but understanding what's going on with your heart is the first step toward managing it. If you're feeling unsure or experiencing symptoms, don't ignore them. Talk to your doctor, and get the peace of mind you deserve. A slow heartbeat doesn't always mean something's wrong, but when it's paired with irregularity, it's worth a closer look. Whether it's simply your body being efficient, or a sign of something deeper, knowing the difference can make all the difference for your heart health. Stay informed, stay proactive, and don't hesitate to ask for help when you need it. Your heart will thank you.